Many of us brush off itching as a small inconvenience, but when it's persistent or localized to specific areas without an obvious cause, it could be an early warning sign of serious health conditions. Unexplained itching in areas like the hands and feet, eyes or breasts may actually signal underlying issues such as diabetes, liver disease, or even certain cancers. Our body often sends subtle signals long before severe symptoms appear. For example, ongoing itching in the hands and feet can hint at diabetes due to nerve damage and dry skin caused by blood sugar imbalances. Persistent itchy eyes could signal liver strain, as toxin buildup irritates sensitive eye tissue. Even more concerning, chronic itching in the breast area can sometimes point to inflammatory breast cancer, a fast-acting disease that doesn't produce a lump like other breast cancers, making it easy to overlook. Understanding these signals can be life-saving. If you notice persistent itching, especially in these areas, consider seeking medical advice. Don't ignore your body's messages, they're there to protect you. For more health insights that help you stay informed and proactive, subscribe to our channel and hit the notification bell. Together, let's listen to our bodies and make our health a priority. First, itchy hands and feet, possible indicators of diabetes and liver disease. Itchy hands and feet might seem like a minor nuisance, but if this itching is persistent and lacks an obvious cause, it may be signaling a deeper health issue. Conditions like diabetes and liver disease are known to present early symptoms that are often subtle or mistaken for everyday discomforts. When itching becomes chronic and resists typical treatments, it's essential to pay attention and consider underlying causes that could have more serious health implications. One possible explanation for chronic itching in the hands and feet is diabetes, particularly when blood sugar levels are poorly managed. Diabetes affects millions globally, and one of its lesser-known symptoms is itching caused by a combination of factors. High blood sugar can lead to dehydration, which in turn causes the skin to become dry, flaky, and irritated. But more significantly, when blood sugar remains elevated over time, it can result in nerve damage, a condition known as diabetic neuropathy. Diabetic neuropathy damages the peripheral nerves, especially in the hands and feet, leading to sensations of numbness, tingling, or, in many cases, persistent itching. This type of itching isn't merely skin deep, it reflects nerve impairment. For those with diabetes, dry skin and poor circulation are significant contributors, as high blood sugar levels reduce blood flow to the skin and extremities. With less circulation, the skin is deprived of vital nutrients and hydration, creating a perfect environment for itching. Diabetics may scratch excessively seeking relief, but this can result in damaged skin, which is vulnerable to infections, a serious risk for those whose healing processes are slower due to their condition. In extreme cases, untreated infections can lead to ulcers or, in severe cases, even necessitate amputations. Thus, this common symptom of itching could have serious consequences if left unchecked. Aside from diabetes, chronic itching in the hands and feet could also be linked to liver disease, specifically a condition known as primary biliary cholangitis, PBC, also referred to as biliary cirrhosis. PBC is a slow-progressing liver disease in which the bile ducts become damaged over time. Bile, a digestive fluid produced by the liver, begins to build up in the liver when these ducts are impaired. This accumulation results in liver damage and manifests in symptoms like itching, particularly in the palms of the hands and soles of the feet. This sensation often intensifies at night, making it even harder to ignore. The itching associated with PBC and other liver diseases is believed to be caused by the buildup of bile acids in the bloodstream, which irritate nerve endings in the skin. This kind of itching often feels deep and relentless, with affected individuals often unable to find relief. Besides itching, other symptoms associated with liver disease include extreme fatigue, dark urine, and dry eyes or mouth, which together may hint at an issue with liver function. Recognizing these symptoms early is critical, as untreated liver disease can progress to more severe stages, potentially leading to liver failure. In both cases, whether diabetes or liver disease, the body is trying to communicate an internal imbalance through this itching sensation. It's a signal that should not be ignored, especially if it persists or worsens over time. If you or a loved one experience unexplainable itching in the hands and feet, it's a good idea to take note of any other symptoms you might be experiencing, like unusual fatigue, skin changes, or digestive issues. This information can help healthcare providers determine whether further testing is necessary to diagnose an underlying condition. By recognizing persistent itching as more than just a skin issue, you're taking an important step in protecting your health. Don't hesitate to consult with a healthcare provider, as early detection and intervention can make a significant difference. When it comes to chronic conditions like diabetes and liver disease, being proactive about these early signals can prevent complications and improve quality of life. For more insights into early signs of health conditions and how to address them, remember to subscribe to our channel and activate notifications. With each video, we're here to help you stay informed and empower you to take control of your well-being. Second, itchy eyes, a potential sign of liver strain. Itchy eyes are often dismissed as a minor annoyance caused by allergies, dust, or fatigue. But when this itching becomes persistent and lacks an obvious trigger, it can be a signal of something deeper, especially with respect to liver health. The eyes and liver share a surprising connection, and chronic itchy eyes could be one of the body's earliest warning signs of liver strain or dysfunction. The liver's primary role is detoxifying the body, breaking down toxins, processing nutrients, and producing bile. However, when the liver is overburdened or damaged, it struggles to keep up with its duties, causing toxins to build up in the bloodstream. As these toxins circulate, they can irritate various parts of the body, including the sensitive tissues in the eyes. This often leads to persistent itchiness that's difficult to alleviate. In addition to itching, those with liver strain may experience red, dry, or irritated eyes, symptoms that collectively reflect the liver's reduced ability to filter toxins effectively. Traditional Chinese medicine has long recognized the link between the liver and the eyes. There is even a saying, "The liver opens into the eyes," which suggests that liver health is directly reflected in the condition of the eyes. When the liver is strained, the eyes often show signs such as dryness, sensitivity, and persistent itching. This is especially common in cases where liver function is impaired by conditions such as fatty liver disease, hepatitis, or cirrhosis. As the liver's ability to process bile and filter blood is compromised, symptoms begin to appear in other areas, with itchy eyes acting as an early warning. One condition that may result in itchy eyes due to liver strain is cholestasis, a disorder that impairs bile flow from the liver to the small intestine. This can lead to a buildup of bile acids in the bloodstream, which not only affects digestion but also causes severe itching, often in the eyes and skin. Cholestasis is common in both chronic liver conditions and can even appear in pregnant women, known as intrahepatic cholestasis of pregnancy. Regardless of the cause, the result is often persistent itching that won't respond to typical allergy or eye treatments. Beyond discomfort, itchy eyes associated with liver dysfunction might also be accompanied by other symptoms, including fatigue, jaundice, a yellowing of the skin and eyes, dark urine, or digestive issues. Jaundice is a particularly important sign as it indicates that bilirubin, a byproduct of old red blood cells, is accumulating in the blood instead of being processed and eliminated by the liver. This accumulation may show up first in the whites of the eyes, giving them a yellow tint and signaling liver issues that need immediate attention. Unfortunately, many people delay seeking help for symptoms like itchy eyes, attributing them to minor causes like dry air or seasonal allergies. However, if these symptoms are persistent, worsen at night, or accompany other signs of liver stress, it's crucial to consider liver health as a potential underlying factor. Ignoring these signs can lead to missed opportunities for early diagnosis and intervention, increasing the risk of more severe liver damage over time. Simple blood tests can often reveal liver function status, including markers for liver enzymes, bilirubin levels, and other indicators of liver health. Addressing these early symptoms allows for proactive measures that can support liver health. Lifestyle adjustments such as reducing alcohol consumption, avoiding fatty foods, staying hydrated, and incorporating liver-friendly foods like leafy greens can alleviate some of the strain on the liver. Additionally, consulting with a healthcare provider can help diagnose any underlying conditions, paving the way for treatments or lifestyle changes that can prevent further liver damage. Itchy eyes might seem trivial, but when viewed through the lens of liver health, they can be a valuable warning sign. By taking these symptoms seriously and seeking professional guidance, individuals can catch liver-related issues in their early stages and take steps to protect their overall health. For more insights into recognizing and understanding early health warnings, be sure to subscribe and enable notifications on our channel. We're here to help you stay informed, empowering you to take charge of your health journey every step of the way. Third, itchy breasts. Warning for inflammatory breast cancer. Itchy breasts are often dismissed as a simple skin irritation or hormonal change, but persistent itching in this area, especially when accompanied by other symptoms, could signal something far more serious: inflammatory breast cancer, IBC. Unlike most breast cancers, which typically form a detectable lump, IBC is a rare but aggressive form that affects the skin and lymph vessels in the breast, causing rapid, visible changes. This type of cancer develops and progresses quickly, often within weeks or months, making early detection critical for effective treatment. Inflammatory breast cancer differs from other types of breast cancer in its symptoms and progression. Rather than a lump, IBC often presents through changes in the skin of the breast. One of the most common early signs is persistent itching in the breast area, often accompanied by redness, swelling, or thickening of the skin. The skin may take on a texture similar to an orange peel, known as peau d'orange, which can be an alarming but important visual clue. In addition, those affected may notice warmth or tenderness in the breast and swollen lymph nodes around the collarbone or under the arms. This itching is more than skin deep. It reflects the inflammatory nature of IBC, which invades the lymph vessels and blocks normal lymphatic drainage, leading to these visible skin changes and symptoms. Due to the speed at which IBC spreads, the window for early intervention is much shorter than with other forms of breast cancer. Many individuals may ignore initial symptoms, attributing them to benign conditions like eczema, an allergic reaction, or even tight clothing. However, The distinct combination of symptoms, persistent itching, skin texture changes, swelling, and redness, distinguishes IBC from common skin irritations and warrants immediate medical attention. Ignoring these signs can mean missing the opportunity for early diagnosis, as IBC often spreads to nearby lymph nodes and can reach other areas of the body rapidly, making treatment more challenging and the prognosis more severe. Another critical aspect of IBC is that the symptoms may intensify at night, disrupting sleep and signaling that something is deeply wrong. If you find yourself waking up due to discomfort in the breast or experiencing itching that just won't go away, it's essential to be vigilant. Waiting to see if the itching resolves on its own can allow the cancer to progress, making it harder to treat effectively. Medical professionals often perform imaging tests such as mammograms, ultrasounds, or MRIs to examine the breast tissue and may recommend a biopsy if inflammation or other signs suggest a potential cancer diagnosis. Early diagnosis and prompt treatment are crucial in managing IBC, as this cancer type requires a different treatment approach than other breast cancers. Often, the initial treatment plan includes chemotherapy to shrink the cancer, followed by surgery and radiation therapy. Recognizing and addressing these symptoms early can make a significant difference in outcomes, underscoring the importance of listening to your body and seeking medical advice at the first sign of unusual or persistent breast changes. In summary, itchy breasts, particularly when accompanied by symptoms like redness, swelling, and skin thickening, are a sign that should never be ignored. Persistent breast itching may not just be a harmless annoyance, but could be your body's way of alerting you to a serious condition. If you or someone you know experiences these symptoms, consult a healthcare provider as soon as possible. Early detection is key to catching IBC before it advances, giving you the best chance for effective treatment. For more information on recognizing early health warnings and symptoms of serious conditions, subscribe to our channel and enable notifications. Staying informed can make all the difference in safeguarding your health and well-being. What to do if you notice these symptoms? If you're experiencing persistent itching in areas like your hands, feet, eyes, or breasts, it's crucial to take it seriously, especially if the sensation doesn't have an obvious cause. The body often uses subtle symptoms like these to communicate underlying health concerns. While itching may seem minor, chronic discomfort could indicate conditions such as diabetes, liver disease, or even inflammatory breast cancer, all of which require timely intervention for the best possible outcomes. First, take note of any additional symptoms you may be experiencing alongside the itching. For example, is the itching in your hands and feet accompanied by numbness or tingling? Does it worsen at night? Are you also feeling tired, noticing changes in skin or eye color, or experiencing digestive issues? Compiling this information can be incredibly useful for your healthcare provider in determining the need for further investigation. Second, schedule a visit with a healthcare provider to discuss your symptoms. Simple tests, such as blood tests for liver function or blood glucose levels, can reveal whether there is a deeper health issue at play. In the case of breast-related symptoms, imaging tests like a mammogram or ultrasound can help identify any abnormalities. Your doctor may also recommend other diagnostic tools based on your specific symptoms and medical history. While waiting for your appointment, avoid excessive scratching to prevent skin damage, especially if you have diabetes or a compromised immune system. Consider applying soothing lotions or cold compresses for temporary relief, but be cautious with over-the-counter treatments until you understand the root cause. Finally, adopt lifestyle habits that support overall health, and may help reduce strain on the body's systems. For instance, maintaining balanced blood sugar levels, reducing alcohol intake, eating a liver-friendly diet, and prioritizing hydration can all benefit your health. These steps can support your body's natural processes, improving your ability to manage potential underlying issues. Persistent itching is more than a trivial inconvenience. If you're noticing these signs, don't ignore them. Taking action early can make a meaningful difference. For more essential health insights and tips, subscribe to our channel and hit the notification bell. We're here to empower you with information that helps you take control of your health, one step at a time. Proactive healthcare for longevity. Recognizing the body's subtle signals is an essential part of proactive healthcare, especially when it comes to persistent symptoms like unexplained itching. Often, our bodies provide quiet clues to internal issues long before more severe symptoms emerge. By paying attention to these early indicators, we can take preventive steps that may significantly impact our health and longevity. Persistent itching in areas such as the hands, feet, eyes, or breasts isn't just an inconvenience. As we've explored, these symptoms can sometimes indicate deeper issues like diabetes, liver disease, or inflammatory breast cancer. Each of these conditions benefits greatly from early detection, where intervention can help manage symptoms and potentially prevent progression. By taking even the smallest symptoms seriously, we can catch health issues early, allowing for better treatment options and improved outcomes. Living a long, healthy life often involves adopting habits that support preventive care. Regular checkups and health screenings, maintaining a balanced diet, staying hydrated, and managing stress are all critical in safeguarding our health. A healthy lifestyle reduces the body's overall strain, supporting organs like the liver and heart, which play key roles in filtering toxins, balancing blood sugar, and promoting overall wellness. When we prioritize these practices, we build resilience against potential health issues, ultimately enhancing our longevity. Another powerful aspect of proactive healthcare is awareness and education. Staying informed about early warning signs, like persistent itching in specific areas, helps us understand when to seek medical attention. Consulting a healthcare provider when unusual symptoms arise can make the difference between catching a health issue early and facing a more complicated treatment process later on. It's always better to be cautious and proactive, as early intervention often leads to more successful outcomes. Remember, your health is your greatest asset. Listen to your body and prioritize small actions that lead to lasting wellness. For more guidance on identifying symptoms, enhancing your health, and taking proactive steps, subscribe to our channel and hit the notification bell. We're committed to providing valuable information that empowers you to take control of your well-being and live a long, fulfilling life.